Hello. Namaste everyone. I welcome you all to this presentation where we'll have discussion over diet during pregnancy, Garbhaposhan and fetal circulation. So before we start, I bow my gratitude to Dr. Nutan ma'am and Dipti ma'am, Sneha ma'am and Dr. Sarita and all my batchmates. I'm learning from all of you, so you all are my guru. So may I recite this mantra: Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Param Brahma, Tasmai Shri Gurube Namaha. So to start with diet during pregnancy, let us first see what is the role of diet during pregnancy, what it's supposed to do. So Ayurveda has mentioned the diet regimen for pregnant women in a very detailed format, which is known as Masanumasic Garbhini Paricharya, which mentions what to eat in what month so that we can have a proper growth and development of the baby. So the sloka mentioned in Charak Samhita, it says, Striya Yapana Garbha Stridha Rasah Pratipadyate Swa Sarira Pustaye Stanyaya Garbha Budhaye Cha. That means it should nourishes the mother's body, it should improve the breast milk quality and quantity, and at the same time it should nourish and develop the embryo. So for the diets we can go to the trimester wise diet. In first trimester it mainly focuses on the stabilization of the pregnancy, and as the woman is getting more nausea and vomiting as the first sign, the mantra for the first month says Prinanam Brihanam Brishyam Medyam Balyam Manaskaram Jivaniyam Shramaharam Swasakasa Nivahanam, as said by Sushruta Sarirasthana. So it says about the food should be liked by the mother and the baby, and it should enable the growth of the baby. Brihanam Brishyam, the growth of the reproductive organs, the intellectual growth, the physical growth, the medium balyam. It should keep the maintain the state of mind. The food should give us life. The fresh food, Shramaharam, to reduce the anxiety and the fatigue. And at the same time, looking at the future journey of pregnancy, it should not create any breathing related problem. So the women can include milk is the very important part of the diet during first trimester. The hydration, the juice, the panchamrit she can have in daily morning, and the dry fruits and nuts she can add in the stock format. The sustic rice is very useful for the growth and development of the baby, which should be included. And the micronutrients and macronutrients also we need to take care. In the second trimester, it is more mainly focused on the growth of the baby and the pregnancy. So the heart manifests itself. It is the development of the sense organs and the brain and intellectual part. The food need to include our yogurt, honey, home cooked meat, soup, and for hydration, coconut milk, buttermilk, fruit juice, sprouts for the protein, and food which are processed with milk and ghee. Ghee is very integral part of diet during pregnancy. So she can have food, the porridge treated with gokshura. It is advised by the Ayurveda doctors to reduce the enema, that is the swelling. So now let us see the third trimester. We are nearing towards the delivery, the prasava kala. So that is the ghee is again most important to strengthen the immunity, to ease the labor process, boost the metabolism, and it helps digestion and assimilation of the food within the mother body and the baby. During 8th month, there is chance of sudden delivery or miscarriage. So to prevent that, the Asthapan Basti or the Nirua Basti, which is the enema treatment, can be given, which are the medical decoctions are inserted through anal canal. This is the Basti Kriya. And in 9th month, the Basti Kriya can be done by the medicated oils. So this will help the refinement of and the It will prevent the sudden miscarriage. At the same time, to enhance the delivery process, yoni pichu, that is the cotton soaked in oil, can be placed at the woman's vagina that will enable the smooth delivery. So throughout this journey, when we see this food, it should also balances the five nourishing elements that are the space element, the air, the fire, the earth, and water element. So we can see for space, the duration, the interval of the food we should take care. We should eat in positive and peaceful environment. The women should eat light, do not overeat, and at the same time we need to take care not to remain hungry. And the home cooked fresh food which are life giving, the jivaniya food, so no stale, salty or spicy food. And the food should be free from preservative, that is the earth element. We should eat all our five fingers to feel the benefit of eating, and should eat seasonal and local food. And proper hydration should be there to maintain throughout the pregnancy. Water is very important part. So the water can be stored in iron, copper, and mud vessels. So to enhance this integration of the sense organ and whole body, we can use the Panchamahabhutatmak therapy like soothing music and walking on the earth, good fragrance, watching the sun, and all this process will help. Next, we go through this during this diet of the woman. It happens the Garbhaposhan process. So Garbhaposhan can be divided in two parts: the before development of placenta and after development placenta. So placenta develops basically at the 8th month of pregnancy. So before that, it happens through the process of upasneha and vaposada, that is the diffusion and osmosis process. The heat generated in the embryo skin, and through that heat it absorbs the nourishment from the mother's body. But after the development of the placenta, it is the integral part between mother and the baby. So through the placenta and the umbilical cord which connects the baby and the mother, it gives the nourishment to the baby. Next, the diet and nourishment, the circulation plays very crucial part. So the fetal circulation is different than the adult circulation. It starts with tube-like structure that are the heart tube, and going forward it fuses and modifies itself like a bulb-like structure, and then it rotates to create the proper heart-like feature. So the heart looks like in the outer visible outer skin, but internally there is difference between heart structure of a adult and a fetal. So let us see the more detail. So here you can see the placenta and the umbilical cord are attached to the baby's heart, and there are pulmonary artery, sorry, umbilical artery. Two umbilical arteries are there, and one umbilical vein is there. So this carries the blood, oxygen, and nutrients from the mother's body to the baby's heart. In this process, it bypasses the liver and the lungs also, because the blood which goes to the liver and lungs, it goes for the nourishment. Now to see the heart structure in more detail, you can see the blood, deoxygenated blood is collected from the upper part of body and the lower part of body through big arteries that are the superior vena cava and the inferior vena cava. So this deoxygenated blood is collected at the right atrium. From the right atrium, it goes to the right ventricle. And from this right ventricle, the blood will goes to lungs. But here baby collects the oxygenated blood directly from the mother. So the blood which goes to the lungs is basically for the nourishment of the lungs. In this process, the valve between the right atrium and the left atrium is not properly closed. So there is mixing of deoxygenated blood and oxygenated blood. While this blood comes back from the lungs through the pulmonary artery, it again it again goes to the left atrium, and from there it is spread to throughout the body, and that goes through the aorta. But basically here we can see the pulmonary artery and the aorta, there is mixing because there is one more opening there, that is known as ductus arteriosus. So this opening of this heart sometime considered as hole in the heart, but after baby birth within 30 minutes these valves are closed and the heart start working as like a adult heart. So this is the part of fetal circulation. So to enable this nourishment and circulation properly during pregnancy, Ayurveda suggests yoga and pranayam for the proper nourishment. So there are many yoga and pranayam processes. I have mentioned few here. The Setu Bandhasan, Brikshasana, Baddha Konasana, Majarasan, Supta Baddha Konasana, and Viprit Karni. These are very good for the nourishment. It increases the pelvic strength and the circulation. At the meantime, we need to have a balanced mind because that regulates most of our physical activities. So deep breathing, Anulom Bilom, Ujjayi Pranayam, Sitali Kriya, Kapal Bharti, and Tratak Kriya, it helps giving the positive attitude towards pregnancy. So along with that, the mother can give the positive affirmation to herself and to the baby, so that she can say, I am prepared for whatever birth my body and my baby needs. This prepares the mother and the baby for a beautiful journey. And with this, I end my presentation, but I must include here, like when I'm starting my this new journey, when I'm very lucky and blessed to find Dr. Nutan ma'am in this journey, and it will stay with me forever. Along with this, I'm grateful to all my batchmates to give their precious time to listen to me in all these times. So thank you, everyone.
Very nice, Smita. As usual, you did so well and scientific way. Thank you so much for presenting the topic very nice way. प्रियंका ने बोला है 12 मिनट तुमने लिए हैं. Very good. You can read comments for your presentation. Okay. Anybody wants to share anything for Smita?